This 73-year-old male was admitted into the hospital 3 days ago after experiencing a fall and hitting his head at his care home. When he was brought into the emergency room, he was found to have a gastrointestinal bleed resulting in anemia. His head CT is clear, however, he does have a laceration on the back of his head resulting from the fall. He has a full coat, no known allergies. He has a history of osteomyelitis and a past surgical history of a CABG. His activity level is as tolerated with standby assist. Diet is clear liquids, but avoid red and purple liquids as they may be confused for blood. He has a 20 gauge on his left forearm that's currently saline locked. However, it had been previously used to transfuse 2 units of FFP and 2 units of packed red blood cells. His hematocrit and hemoglobin are being checked every 6 hours. The current readings, hemoglobin 8.1, hematocrit 25.2. Pain level, he has had no pain, no complaints of pain at all for us today. He, neurologically wise, is alert, awake, and oriented times 4. His pupils are equally round and reactive to light and accommodation. Cardiac-wise, he's sinus rhythm, normal sinus rhythm with rate in the 70s. His blood pressure readings are a little low. The lowest one we got for us today was 97/62, and the highest one was 104/59. He said hypotension is his normal, his baseline for him. He has had 1 black form stool for us today, which we had notified the doctor about. He's urinated 5 times today. He has full function over both his bladder and his bowels. However, his mobility is somewhat poor, which is why he needs a standby assist. His gait is a little unsteady, so he prefers to use the urinal rather than going up to the bathroom, and he also prefers to use the bedpan. In terms of skin, last shift reported that he had edema on his bilateral lower extremities. However, during this shift, we did not notice any sort of edema anywhere throughout his body. He has 3 wounds, 1 back of his head, which is left open to heal. He has no complaints of pain, no erythema, and no swelling at the wound site. He has 2 other wounds on his foot, one on his right foot measuring at 2 centimeters by 1 centimeter. It's a superficial wound, and it is covered with Medi-Honey and a gauze dressing. He has no complaints of pain and no drainage there. He also has another wound on his left foot measuring at 1 centimeter by 1 centimeter, also covered with Medi-Honey and gauze, and also no complaints of pain, erythema, or swelling at that site either. In terms of medication, he's only taking cephalexin 3 times a day. He's going to be transfused with blood if his hemoglobin does drop below 8. The doctor is to be aware if that happens, and his hemoglobin and hematocrit are being checked every 6 hours, so you have to look at the lab results every 6 hours. You also want to watch his BMs, try to see if there's any evidence of blood in his BMs, and watch his vital signs for evidence of hemodynamic instability. You want to check his blood sugars at meals and at night because he does have type 2 diabetes. And for us today, the last blood sugar was 137, so we did not give any insulin. However, at lunchtime, his blood sugar was 173, so we did have to give 2 units of insulin. Other than that, there's really not much else on this patient. He's calm and cooperative and a good patient to work with.